Hi and hola para amigos. Academic Medicine is a prominent journal in medical education field, and they publish concise summary of a topic in a page called AM Last Page. In this video, Flamingo will meet you 6 common pitfalls of feedback conversations from AM Last Page. If you're involved in feedback conversations in your professional life, these pitfalls would be for you. The publication offers useful tips on how to repair these mistakes as well. These pretty flamingos are excited to explain and get you to give healthier feedback. But first, the intro. The first pitfall is emotion stunt. I believe all of the medical educators went through this. When you encounter an emotional reaction that is not expected and feel paralyzed. In this situation, intense emotion may derail the feedback conversation. Without feedback, there are no opportunities for improvement. So, how can we repair the situation? Authors offering to pause and ask if it is okay to continue, and talk about the emotions being experienced after confirming comfort with continuing. After repairing it, you should prepare yourself to avoid making same mistakes. To do so, the authors offer 3 enablers. First, think about whether the conversation triggers identity, personal or professional issues. Second, schedule feedback based on the learner's readiness and availability. Third, explore your own reactions, including implicit bias. Second pitfall is clear as mud. As you know, improvement cannot happen without understanding. It could be a problem when you give feedback that is jumbled and the learner looks confused. To repair, ask the learner how you are being heard. To not being confusing for the next time, make an agenda and end by discussing what both you and the learner taking away from the conversation. The third pitfall is data dump. When you give too much feedback all at once, cognitive overload inhibits comprehension and action. A large list of areas for improvement may reduce confidence. When you made this mistake, acknowledge and apologize for the feedback overload. Choose together which topics to discuss and which to delay. To avoid making data dump mistake next time, elicit the learner's self-assessment before giving feedback. Start with the learner's goals unless your list has an urgent safety concern. Pitfall 4 is the sandwich. It happens when your hard-hitting feedback is wrapped in positive generalities, such as your performance was good, it was good, etc. If you do this, your hard-hitting feedback may not be heard. If the student perceives that you compile random praises, it may result in loss of trust. To repair it, directly discuss areas for improvement. When discussing positive observations, provide concrete examples. Ask what the learner would do again and what the learner would change next time. Next time, it would be useful for you to organize feedback into 2 columns, specifying what the learner has done well and what needs improvement. When you fill the columns, address all feedback in one column before moving to the next column. Pitfall 5 is again, if you restate the same feedback after witnessing the same issue repeatedly, there is a problem. It's a sign of the mismatch between learning needs and teaching methods. To repair it, get curious. Describe the exact problem and how to change it. You should prepare yourself for the next time by reflecting on patterns. Last pitfall, pitfall 6, is authoritarian royalty. When you shame the learner intentionally or unintentionally by implying "we all know," openness may be inhibited. Implied lack of respect may inhibit effective learning relationships. If you used it to repair it, explain the basis for your statement. Next time, use "I" instead of "we." Throughout the video, you listen to pitfalls and how not to make these mistakes. I hope you remember and use these useful tips in your daily and professional life. If you want to take a look at the source of this video, you can find it in the description below. See you and adios para amigos. And also, don't forget these flamingos.